U.S. unemployment claims continued to rise last week, the third straight week of increases. 362,000 Americans filed for jobless benefits last week. That is up 11,000 from the week prior. Applications for benefits had been falling as COVID vaccines have become widely available. But that trend has reversed as the Delta variant spreads. Washington Post economics correspondent Heather Long joins me now with more. Hi there, Heather. So unemployment claims rose again last week for the third straight week. How is that the case when many employers say that they are struggling to find workers?
Yes, it's a great question. What we're seeing right now is the remnants of the Delta variant flowing through the economy. We have seen some pullback in spending and pullback in people traveling and wanting to fly places and stay in hotels, and to a lesser extent, wanting to go out to restaurants. So we had sort of this great reopening over the summer, and then we had a bit of a paring back in August and September. And I think you're seeing the remnants of that flow through and with those higher unemployment claims, a few people who have been laid off. The question on everybody's mind, you were just talking about it in your prior segment, is what happens this winter? Do we continue to get better, more people vaccinated, put this COVID crisis behind us, or are we all about to see another big surge this winter?
Yeah, and you report on what you call the great reassessment happening in the workforce. Heather, what does that mean exactly, and how does it play into the rising unemployment rate?
Obviously, the nation has basically 11 million job openings right now and roughly 8.4 million unemployed people. So a lot of people obviously sit here and say, why can't all these unemployed people just take the job openings that are there? And I think the big thing that people are forgetting that I just keep hearing over and over again is this was a real shakeup in people's lives, not just losing work in some cases during the pandemic, but there was also staying home more and the health crisis. And it really made people reassess what they want to do with their lives. I call it the YOLO, you only live once, on steroids. People knew that before, but now it's really hit home that it's now or never to change your life in some big way. And so the jobs that are open are mainly in retail and restaurants. And a lot of people don't want to go back to those jobs. They want more flexible jobs, maybe to work remotely, something that they can have more time with family. I was just on the phone with some restaurants earlier today, and this one restaurant owner said to me something very telling. She said, I can find a lot of people who want to work the 9 to 5 shift. I can find hardly anyone who wants to work the evening shift. Again, that desire for how people want to work, the way they want to work, where they want to work, has really changed in the past 2 years.
Right, and people are just making these kinds of assessments or reassessments, as you say, about the value of their time and how it is that they choose to spend it, and whether or not that labor that they're providing is going to sort of coincide with their sort of, new perspectives. Factoring into this broadly is the issue of childcare. And Heather, I know you've reported on this extensively. It is facing a hiring crisis. The industry is still down 10%. Some 127,000 workers since the start of the pandemic. What makes recruiting and retaining childcare workers so difficult?
Yeah, it's pretty simple. This is a really tough job, and it's been harder during the pandemic. Trying to keep those masks on 2- and 3-year-olds is a Herculean task. And at the same time, pay has barely gone up in a lot of daycare and childcare centers. The typical pay is $12.24 an hour. Often those jobs do not come with benefits. So no healthcare benefits, no 401k benefits. And those jobs were typically filled by young women, especially young women of color in their late teens and early 20s. And now those young women have a lot of opportunities. They can go work, and they are choosing to go work at a Walmart or at a warehouse, or even as private nannies, where they can earn more money and they are not as exposed to the coronavirus because maybe they're only working with 1 or 2 children as opposed to having a whole classroom of children. So I've been calling this a crisis, and I don't usually throw that word around lightly, but there is a childcare crisis right now. We do not have enough childcare openings and enough childcare workers, and I don't see an easy fix to this anytime soon. I don't see that. It's much harder for daycare centers to raise that pay than it is for, say, a restaurant to raise pay because of the way the business works.
Right. And on that point, Heather, in our final minute or so that we have left, can you talk about how this crisis, as you call it, in childcare ripples through the entire economy? When you talk about a labor force of people who would normally be seeking employment outside the home, who are having to contend with childcare issues, what is that broader effect then on the economy?
It's a big effect on the economy. Obviously, if people's kids are not able to go to daycare, then the parents can't go to work, or it's much, much harder for them to try to go to work in their regular jobs while they have to juggle the childcare responsibilities. You mentioned earlier in the program that generally speaking, 96% of public schools are open right now, while daycare centers are only functioning at 88%. So there's still much, much lower capacity in the daycare and childcare centers. I've heard from a number of parents who told me, I thought I had it all figured out. My child was enrolled in an after-school program. I got a note the night before school starts. The program has been canceled. There is not enough staff. What am I going to do?
Yeah, I mean, I know there's been a lot of talk in Washington, Heather, as I know you're well aware, about addressing childcare issues. We'll see if there's any movement and what kind of analysis and data they use to support that. But clearly, there is such a need for a more improved childcare system and options for parents who want to work outside the home. Heather Long, I'm afraid we're out of time, but it's really great to talk to you. Thanks very much.
Thank you.